I'm Dr. Scott Fuller. I'm going to lay out a plan for you on how you can improve your health and your family's health right now, how to save conservatively $500 billion in healthcare costs in this country right now, and create jobs all at the same time. Now, I've laid out this plan in detail in the past on a couple of cable television shows, which are also on YouTube. So if you want to get more details, just go to my YouTube page and you can check that out. Our current healthcare system is not focused on prevention and wellness. We have more of disease management or crisis management, and I'm saying to you now, let's focus more on prevention. Well, how much can we actually save on prevention? How much money could we save? Harvard School of Public Health, on their segment, diseaseriskIndex.harvard.edu, it's a tool that you can go in and find out what your risk index is right now. In 2008, they states if everyone in the United States led a healthy lifestyle right now, 80% of the cases of heart disease and diabetes could be avoided, as well as 70% of the cases of stroke and over 50% of all cases of cancer. Now, I personally believe, backed by research, that the cancer prevention rate is more like 66% or 2/3. So if you average that out, 3/4 or 75% of heart disease, diabetes, stroke, and all cancers can be avoided if we follow a healthy lifestyle. To back that up, another article on February 17th of 2011 in the Dow Jones News Service titled Cholesterol, the Good, the Bad, the Unknown. At the very end of the article, the last statement by Dr. Robert Eckel, he stated, "I have to emphasize that a healthy lifestyle is the #1 step to reducing your risk of heart disease." Number one. Notice both of those cases. We didn't talk about mom and dad. We didn't talk about genetics. We didn't talk about drugs. We talked prevention by healthy lifestyle. Next cost savings measure that we'll get into. There is no MRSA in Norway. Why? Well, they stopped giving antibiotics for self-resolving infections such as colds and coughs. It's the most infection-free country in the world right now, by the way. And an AP article in December of 2009 stated, solution to killer superbug found in Norway, meaning MRSA, the superbug. It states, it's a very sad thing that in some places so many people are dying from MRSA because we have shown here in Norway that MRSA can be controlled and without too much effort, says the MRSA medical advisor in Oslo. But you have to take it seriously, you have to give it attention, and you must not give up. New studies from around the world prove that Norway's model of preventing MRSA can be replicated with extraordinary success, and public health experts are saying that these deaths, 19,000 deaths from MRSA each year in the US alone, can be prevented and are unnecessary. The last cost-saving measure before I get into my proposal for you is chiropractic. Chiropractic has been shown in the research to save money. Neck pain and back pain, particularly chronic neck pain and back pain, lots of people have it, and it's extremely expensive. Chiropractic has been shown to be 5 times more effective than nonsteroidal anti-inflammatory medications in treating these diseases, and has better long-term positive effects and better patient satisfaction rates, so we better shore up chiropractic benefits in the healthcare reform as we're going down the road. We spend $2.5 trillion per year on healthcare in the United States. We spend more money via the GDP, 15% right now, on healthcare, and we spend more money per person than most of the industrialized nations around the world, I think all of them. But we don't have the best health. We have some of the highest infant mortality rates in industrial nations. We have lower life expectancy. We have a lower quality of life. With all of this money spent, you would expect us to be the healthiest, and we're not. The World Health Organization ranks the United States healthcare system at number 37 in the world. Number 37, not number 1, even though we spend all of this money. Well, why is that? Well, we have a system that does not focus on prevention, and that is my proposal for you right now. This is what we should do. Well, what is a healthy lifestyle? A healthy lifestyle, as I had mentioned before in those articles, is very simple. Eat good things and don't eat bad things. Get regular exercise, and I call this the Jack LaLanne process, right? May he rest in peace. Jack LaLanne ate clean and exercised every day and lived until 96, right? And the last thing is, of course, is don't smoke. Those are the three things that we need to do. Eat right, exercise every day, don't smoke. If we do those things, I believe conservatively we can save $500 billion per year in this country. Harvard School of Public Health just said that we can do that. The system that I recommend is similar to the anti-smoking campaign. The anti-smoking campaign, what we did is this. We spent time and money and focus, media attention, and we got into school systems and we taught kids early on how bad it was to take up the habit and so forth. Was the campaign totally successful? No. But was it worthwhile? Was it worth our time and money and focus? Absolutely. The smoking rates clearly went down, and it's very well established that everyone knows that smoking is really bad and you're going to die from it and get cancer and stuff. So we know that this program was worth the time and effort. This new disease prevention program that I'm proposing is focused on that. What we're going to do is set up clinics in every town around the country. In bigger cities, we'll have several clinics in that city. In smaller towns, maybe we'll have one clinic that will serve 2 or 3 towns, however it works out as we move along. In these clinics, we're going to have classes in 2 different areas. We're going to have nutrition classes and exercise classes. Now, in the nutrition classes, it will have several focuses. One is we're going to teach people the basics of nutrition. This is food, this is not food. Eat more of this, don't eat these things. Then we're going to show people how to shop for healthy food with the same amount of money. We'll show people how to eat out for the same amount of money, but select healthier things that prevent heart disease and stroke and cancer and diabetes and not cause it. We're going to show people with food stamps on how they can shop for healthier foods as they move along and buy healthier foods. Unfortunately, right now, people with food stamps are oftentimes forced into buying higher calorie processed foods because their food stamps go further in doing that. And we know that government subsidies of high fructose corn syrup and processed foods and so forth make those foods cheap. Fresh fruits and vegetables are more expensive, so we'll probably need to revamp the food stamp program to allow food stamps to go further for fresh fruits and vegetables and whole grains and lean meats and not go nearly as far for processed foods and sodas and packaged foods and so forth. Cooking classes will be available in these clinics. Cooking classes showing people how to prepare healthy, tasty, quick meals with the foods that they just shopped for in the supermarket. Now, how is this going to create jobs? Well, we're going to have to staff these clinics with nutritionists, cooks, chefs, chiropractors, MDs that think that this is important. We'll need social workers and counselors there. So this is going to create jobs as well. On the exercise front, we're going to have exercise classes 7 days a week, 365 days a year, and these exercise classes will be focused on making sure that whatever somebody's physical health is at that moment in time, we can specifically tailor their exercises to where they are at that moment. Maybe we'll also staff doctors and nurses there to conduct physicals on an ongoing basis to have that available at these clinics as well. On the exercise classes, we'll have to staff that with people as well. Exercise physiologists, personal trainers, physical therapists, and chiropractors. Anybody that can teach exercise and do one-on-one in classes will have to staff these. How are we going to fund it? Well, we will fund it with federal stimulus money. What a beautiful place to put federal stimulus money right now, right? Is to fund these clinics, which is going to, on the long term, save us $500 billion a year, particularly on Medicare costs. So it will very much pay for itself over time. Maybe we'll require the private medical insurances to have to kick in a little bit of money to fund these clinics as well. And they'll be happy to do so. They'll put in a little bit of money now, but they don't have to shell out all of this money for these expensive chronic diseases like heart disease, stroke, diabetes, and cancer, and Alzheimer's and dementia, which we can also prevent. They won't have to shell out all these big dollars to treat these diseases as time goes along. Again, and as a reminder, I've done a couple of cable television shows on this program in detail. So you can just go to my YouTube page and check out those shows on healthcare reform and job creation, and you can look at those. If healthcare costs us $2.5 trillion per year, I believe that focusing on prevention and wellness and disease prevention, like I'm laying out right now, just like Harvard School of Public Health told us we can do, reducing those healthcare costs by 75%, that we can save $500 billion a year right now. I'm Dr. Scott Fuller. Please join me again.